have a presentation by Prescott Binder, who did mapping the precise anatomical insertion of the medial ulnar collateral ligament complex of the elbow. And he did that with Dr. Barthright.
Hello, I'm student Dr. Prescott Binder, and my project was mapping the precise anatomic insertion of the medial ulnar collateral ligament of the elbow, and my mentor was Dr. Wright. A little bit of background on the medial ulnar collateral ligament. It's comprised of 3 bundles. You've got an anterior bundle, a posterior bundle, and a transverse ligament. These 3 form a complex that's main function is to stabilize the elbow during valgus stress, which is demonstrated in the picture in the bottom right with the milking maneuver. Most of the stabilization, however, is achieved by the anterior bundle, and so that's where my project focuses on. The problem I found was that there's a recent review article that was highlighting discrepancies between reported ulnar anterior bundle insertional areas, where historically it's been reported to insert directly onto the sublime tubercle, but more recent studies have showed insertion of the anterior bundle to the sublime tubercle, but also extending with an elongated and tapered insertion along the ulnar ridge. So my question was basically, is the area of the anterior bundle larger than historically reported? And the aims of my study were to precisely identify all of the dimensions of the anterior bundle of the ligament complex so that I could determine the overall footprint of the ligament. And I also wanted to compare my results to the historical data to see if it's different, and then discuss how my findings could possibly relate to current and future surgical repair of this ligament. So the significance of the study is that no study in the review article that I found reported all of the dimensions needed to outline the precise footprint of the anterior bundle. And in the present study, it's the first study that I know of that did compute all of the values. So also previous studies reported only a median of 10 elbow specimens, and I used 20 for my project. So my methods were I dissected the elbows of 10 cadavers in the KCU anatomy lab for a total of 20 elbow specimens. I fixed the elbows at 90 degrees of flexion using an anthropometric caliper and zip ties. I then imaged all of the elbows next to a reference ruler, and then imported the images into a software called ImageJ to measure and compute the desired values. So my results are listed here, and in panel A, you can see the average length and the average width of the anterior bundle. And in panel B, in red, you can see the origin surface area. And in blue, you can see the insertional surface area, and in black, the total surface area of the anterior bundle. And I was able to conclude that the anterior bundle of the ligament complex does have a long and tapered insertion onto the sublime tubercle, but it extends along the ulnar ridge. And this gives it a much larger surface area than historically reported. And this demonstrates that current methods of surgical repair of this ligament directly to the sublime tubercle may still need to be optimized to resemble native anatomy and to achieve optimal radiographic and clinical outcomes. Some limitations of this study was I used a 2-dimensional imaging software to compute my values, whereas some of the other studies I found used more expensive 3-dimensional methods to compute the values. Also, the dissections were conducted and the borders of the ligament were identified by me, and I'm not a trained elbow surgeon, so that possibly could lead to some more error. And also, measurements were taken only with an elbow fixed at 90 degrees, so this did not resemble the entire biomechanical motion of the ligament. So future directions is to complete measurements of the other 2 ligament bundles of this complex. And I could also take those measurements at different degrees of flexion extension for the entire biomechanical motion of the elbow joint. I wanted to acknowledge the donors and their families who were generous with their gifts, the anatomy faculty, especially Dr. Wright, for his help on this project, the custodians who kept the lab clean and safe all summer, and the Department of Research for this opportunity. My references, I have no conflicts of interest. And are there any questions?